Now, let's return to our top story now for viewers who just joined us. US President Donald Trump is being treated at a military hospital after testing positive for COVID-19. His doctor is scheduled to make a statement any time now on the president's health status. And to help me with reporting on that, joining us now is our correspondent Stefan Simons in Washington, and with me in the studio here is Stacey Bivens from our US election team. Stacey, let's start with you. Just bring us up to speed again. What do we know so far about the health status of the president?
Okay, well, the president has been admitted into hospital. He was suffering from shortness of breath, exhaustion, and a low-grade fever. And he's been taking two medicines. The first, remdesivir, is an antiviral drug, and the second is being referred to as an antibody cocktail, and it's an experimental treatment, so it's still in trials. But the company, and it's produced by a company called Regeneron, and the president's, because it's not on the market yet and it is not FDA approved, the president's doctors asked for what's called a compassionate use so that the pharmaceutical company could give him this medicine. And we should point out that Donald Trump is in several high-risk categories. He's 74 years old. He's been treated for high cholesterol, and he's clinically obese. All of these factors make it a little bit more difficult to rebound from the coronavirus.
Stacey, why is this so important? The world is watching, all the news stations, of course, covering this story, waiting for this statement of Donald Trump's doctor. Do you think there's some urgency that this statement is coming now?
I think that it's urgent that the statement comes now because there are so many questions. And when there are so many questions, it makes people nervous and people react poorly. We saw that the markets were taking a bit of a dive yesterday because there was just an uncertainty. People just didn't know. So, and it matters because the U.S. economy affects all other economies. This is a globalized world, so we're all connected. And the U.S. is the biggest. And it's also the lone superpower. So the president, whether you like him or not, is the head of this. And so people are wondering, what does this mean financially? What does this mean for national security? So these are things that everybody's looking at. The Pentagon says that everything is fine and that there are things in place where if the president becomes sicker, the government can still function as usual.
Well, let's turn to Stefan Simons in Washington. Stefan, Stacey just said there's so many open questions. How would you characterize the information policy from coming from the White House with regards to Trump's health and the COVID-19 infection?
As a failure. The White House failed yesterday and up until now to really provide a constant stream of information to the American people, to the press here in Washington or elsewhere. And that is kind of typical and somewhat expected under normal circumstances from the Trump White House.
I have to interrupt you. The doctor treating Donald Trump is about to make his statement. His name is Conley, and let's listen in.